to see to deliver it in a clay jar shortly after sunrise. It's still warm. Freshness matters in your line of work. You set it on the table like a fine wine and hold it up to the light. What little light you have streaming through your tiny smoke-stained window. You swirl it gently, inhale deeply, and make a thoughtful sound with your mouth that says, "Ah, yes, this man is clearly suffering from excess phlegm, and also, possibly, envy?" Welcome to uroscopy, the medieval art of diagnosing illness by examining urine. Its colour, clarity, scent, thickness, and, yes, occasionally taste are the primary diagnostic tools in your arsenal. Forget stethoscopes. Forget thermometers. You've got 16 shades of yellow, a vague chart from a monastery in Flanders, and an instinct honed by years of pretending to know what you're doing. Clear and pale. That's good. Deep orange? Liver trouble. Murky brown. Probably hot bile or punishment from Mars. Blue? Witchcraft. Definitely witchcraft. If your patient's urine has bubbles in it, that might mean they're about to die. If it doesn't, you might still tell them they're about to die, just to be safe. After all, people appreciate honesty. You might even warm the sample with a candle to wake up the humours, a bit like microwaving soup before serving it. You then record your findings on a little wax tablet and scribble something vaguely Latin that even you'll struggle to read later. And when your patient nervously asks what's wrong, you nod wisely, point at the jar, and say something like, "Your collar is inflamed, and your spleen is melancholic. Avoid figs, loud noises, and women named Agnes." You hand them a pouch of herbs, a small talisman, and possibly a leech, and send them on their way feeling both confused and vaguely reassured. Because in the end, what matters isn't curing them. It's sounding like you could if you really wanted to. As a medieval doctor, you don't ask your patient if they've been sleeping, eating properly, or exposed to mouldy bread. No, you ask the real questions, like, how often have you been visited by black bile this week? Because everyone knows your body is controlled by 4 sacred fluids: blood, phlegm, yellow bile, and black bile. It's not about bacteria, or viruses, or nutrition. That's future nonsense. The human body is basically a boiling cauldron of wet medieval soup, and your job is to make sure none of the ingredients are winning. Let's say your patient is angry and flushed. Clearly, too much blood. The cure? You take some of it out. They're tired and pale? That's excess phlegm.